Without Borders. We want today to meet with our dentist. We want to know one or two things about what dentistry is about, and we shall have that interview inside a very executive dental clinic. Just have a look. Let's see. We have a very executive dental clinic, and it is inside here that we shall have our interview. So welcome. Let's keep listening and hear what our dentist has to tell us. Good afternoon, doctor.
Good afternoon.
How are you?
I'm well.
We have visited your clinic today.
Yes.
And what we are interested in knowing is what is a typical day like of a dentist?
Typical day like a dentist. Usually it's an 8 to 5 job. So we are here by 8 o'clock.
Yes.
But, as a dentist, you come before 8.
Yes.
So you prepare everywhere. You
Yes.
ensure that the staff is informed about the patients that are booked during
Yes.
the day.
Yes.
So if there are like 6 patients booked per day,
Yes.
usually we plan now each procedure. Each procedure, how it works, basically, the nurse will sterilize all the instruments.
Yes.
And ensure they are all ready for the upcoming appointments.
Okay.
So depending on now, sometimes you have even walk-ins.
Yes.
So walk-ins, they come in between their appointments. So you
Yes.
have to also cater them inside the schedule of the day.
Okay.
Yes.
What would you say is the highs and the lows, the difficulties you have experienced or the easy times you have experienced on a typical day as you go on your work as a dentist?
Day by day, there's highs and lows during the day. Sometimes you might get a case or a very difficult, complicated case that will prolong the appointment. Because it was scheduled for 1 hour, maybe it might take 2 hours. Sometimes you also have to ensure that for some children, sometimes you have special needs children, which you have to at least take more time to try and encourage them and also do some sort of therapy with them before you can proceed with the procedures. Those are usually the low times in which you find that you have to have a give and take agreement. The high times you find that sometimes the patient comes very excited, he comes back again just to tell you that he was very happy and satisfied with what you did and how you treated them, and they wanted to even come with a referral from their friends to tell them, just not even to be treated, just to say hello.
Wow. So I can see that you have a lot of passion for what you do. What would you advise a young person who wants to study dentistry? What do you tell them they would expect, both as a student and as an intern, and later going into practice? What would you advise a young upcoming person?
I would start basically from the ground and then moving upwards. From the ground, basically you have to understand all your sciences. All your sciences, the biology or chemistry, your physics, because these are all encompass all the sciences within. Also, that's when you enter the university level as a student, you find that you have to have a mentor within maybe if it's you're in first year, you have to have a mentor in second year or even third year, so that they can guide you and tell you this is how they're able to solve each of the concerns, the problems, and the challenges that came with each year. Even as you move on into intern, when you finish and become an intern, there are also consultants who have moved ahead, who you deal with before, like for a whole 2 years. They're known as residents. So you find that you have some sort of residency program. So even though you have learned all you have learned in the university, you have to now practically use the skills. And when you use your skills after internship, even when you reach a consultant, you don't just work alone these days now. Now you work like an associate. You work as a group of consultants, so that you find each has a different skill and it does a different technique in as the years go by.
Oh, thank you. Doctor,
Yes.
tell us, we know that teeth are very delicate and they are very painful. How come I hear many people saying that the greatest pain comes at night? What is the science behind that? Can you simply explain it to a lay person?
Usually, you find out what is the cause of the pain. Pain is basically starts from the nerves, and the nerves usually are they end usually either in the fingernails or on the teeth. The endings, the nerve endings. So when you find that when you're sleeping, you find that saliva usually accumulates on one side, and that saliva has different organisms within it. So the saliva has good bacteria and bad bacteria. So when you find that that area of your tooth is exposed by basically having either a cavity or you find it having decay, you find it accumulates on that side, then it constantly seeps within the tooth area. So you find these nerve endings, they are connected all the way to the brain. So in the brain, when you're sleeping, there is that sleep response. So you find that you're not even able to sleep. So the only thing you're concentrating on all through those 8 hours, as you're not doing anything else or working or using your hands, you're just concentrating on the tooth side. The tooth, you find it's very near the nerve ending towards the brain. So you find it's very intense, and sometimes people consider that they can't even sleep the whole night.
Wow.
The science behind it.
Wow. I hope we have all heard from a layman's understanding why many people call the doctors at night or come very early in the morning saying they did not sleep because of the pain. Now we have been explained by our doctor the science behind toothache. Doctor, tell us, what is your specialty, or tell us the different specialties in dentistry, and what is your specialty in particular?
Dentistry is a branch. It's a branch of health sciences. In terms of the type of, it's under the topic. There are two different areas, either surgery or under medicine. So you find that dentistry, myself, I'm a dental surgeon, so it's like a dentist, and then I specialize into implants. There are different branches within the branch of dentistry. There's implants, which deals with insertion of devices in the mouth. There is oral and maxillofacial surgery, which deals with oral means the mouth, maxillofacial means towards the top of the cheek, but not towards the nose, and going down to the mandible, that is the lower jaw. And you find that in facial, basically the outer surface. The other sciences behind it are what is known as prosthodontics. Prosthodontics is another field which involves basically addition of any device in the mouth. This could be a denture, this can be, it's called an obturator. Obturator means that anyone who has cancer, your whole jaw has been removed, you can be able to place a whole prosthetic in the mouth. This can be also crowns. This is also involves implants. So you find that that's one of the branches. Then the other branch is orthodontics, which basically means that it's just a straightening of the teeth. And straightening of the teeth is usually use of wires and the braces that you usually get to see many of the young people have. Then another branch is pediatrics, which involves pediatric dentistry, which involves anything involved with the children. You will find that branch of dentistry, it involves anything that deals with children. Then you find another branch is called periodontology. Periodontology is anything that is involved with the gums. So that is also a branch, anything that involves with the gums, with the tongue, also with towards the lower lips. Then another branch of dentistry, you find that there is radiology. Basically, radiology, it means that anything to do with imaging. Anything we do with imaging is like X-rays, the scans that you see. That's another branch of radiology. Another branch of dentistry you find is known as conservative. Sometimes they consider conservative as aesthetic or cosmetic dentistry. Cosmetic involves anything to do with your appearance, improving your appearance. This can be the whitenings you see, the bleaching that you get to see, and then even sometimes the cosmetic, the Botox is also involved in the aesthetics. You find even those, that is also conservative. There's another sub-branch which is known as restorative. Restorative are these feelings that you usually find in terms of having cavities. Those are the main branches within.
Thank you very much, doctor. Now tell us, what is your specialty?
My specialty, as I said before, I am an implantologist, so my specialty is implantology.
So what is implantology? You can give me a permanent tooth?
Yes, it's a device. Basically, it's an addition of, it's like there are different types of metals now we replace teeth. So it's basically replacing your tooth with an artificial tooth.
Okay. Thank you so much, doctor. I think we have learned a lot, and it is very important also as a parting shot to remind our followers, those who are watching you, that it is very important to preserve their natural teeth, isn't it?
Yes, as long even 5,000 years ago, you still find people who have their teeth.
Who have their teeth. So the teeth can last 5,000 years.
Yes.
You have heard about the teeth. Thank you so much. This is Education Without Borders. Today, we had an episode of meeting our dentist. Keep watching, keep learning. We'll be back.